Hello, my name is Tien. This video is part of an assignment for my HHPH 550 Health Promotion Among Diverse Populations. I propose to promote chronic disease awareness and prevention, specifically those that are known as stroke risk factors, for racial ethnic minorities or people of color, which will include but are not limited to Blacks, African American, and or Hispanic, or Latinos. I practice as a full-time neurology neurocritical care physician assistant for about 14 years now and love what I do. However, I feel devastated for my patient population due to the disabilities that they have. Therefore, I want to reach out to these individuals in their community a step before they end up in my neuro ICU. The Centers for Disease Control and Prevention define health disparities as differences in the incidence, prevalence, and mortality of a disease and the related adverse health conditions that exist among specific population groups, which may be characterized by gender, age, race, or ethnicity, education, income, social class, disability, geographic location, or sexual disorientation. Many studies have shown that people of color communities, especially those who live in low income, are most often confronted with various types of disparities embedded in the social determinants of health, leading to chronic disease and poor health outcomes. For example, African Americans are living with disease more common at older ages, as demonstrated here. They are at higher risk for developing high blood pressure, diabetes, and strokes compared to white people. Hispanics people have higher risk of having diabetes, as you can see here. Hispanics have 4.7 points higher than that of white and 5.2 points higher than that of black people. So, can hypertension or high blood pressure, diabetes or high blood sugar, and stroke be prevented? Yes, of course. I would like to take this opportunity to provide you with some education about these conditions.
The health outcome of hypertension may include heart attack, stroke, heart failure, kidney disease or failure, vision loss, sexual dysfunction, angina, peripheral artery disease, according to the American Heart and American Stroke Associations. Health-related behaviors in hypertension may include unhealthy diet, physical inactivity, obesity or overweight, too much alcohol intake, tobacco use, other illicit drug use, and or medication non-compliance.
The risk of someone who has diabetes for a long time may include these health outcomes: hypertension or high blood pressure, hyperlipidemia, hypertriglyceridemia or high cholesterol, heart disease or heart attack, stroke, blindness, kidney failure, amputations of legs, feet, early death, certain cancers, and increased chances of having dementia or Alzheimer's disease. The health behaviors that lead to someone having diabetes include unhealthy diets or diets that are high in carbohydrates and sugar, physical inactivity, overweight or obesity, medication non-compliance, and or non-alcoholic fatty liver disease. Hypertension and diabetes mellitus are among the two major risk factors for having a stroke, which may lead to a person having long-term disability. Stroke ranks as the fifth leading cause of death in the United States, kills about 140,000 Americans each year. It decreases mobility in greater than 50% of survivors aged 65 and older, and stroke is actually the leading cause of serious long-term disabilities. Among all of these, the good thing is that 80% of strokes are preventable. What is a stroke? A stroke happens when there's a problem with blood flow in the brain causing injury to that area of the brain. It can be either an artery going to the brain gets clogged or closes off, or an artery breaks open and starts to bleed in the brain. BFAST is an acronym used for the general public to recognize the signs of someone having a stroke in the community. If any of the following signs are seen, a standby person should immediately seek help or call 911. Here you can see that B stands for sudden loss of balance, E for sudden loss of vision, F if the person's face suddenly look uneven, A is for sudden weakness in one arm or drifting down in one arm, S is for change in speech. It can be a slur or it can be the person unable to speak. And T is for time, which is brain. Every second, brain cell die during a stroke. Therefore, one must seek medical help immediately. It is an emergency. So this is a demonstration of the different types of strokes. Hemorrhagic strokes or bleeding strokes happen where the weakened blood vessel ruptured and blood leaks into the brain. It occurred about 20% of strokes. And ischemic stroke is when the blood clots stop the flow of blood into an area of the brain. It's occurring about 80% of the time. Both of these conditions may occur as a consequences of uncontrolled hypertension and or uncontrolled diabetes, or a person can also have a warning type of stroke called TIA or transient ischemic attack. Some also call it a mini stroke where a person has a temporary blockage of blood flow, yet it got restored. And so the person may have the signs and symptoms of a stroke, but then it's just a warning sign for that person to go and seek medical help before an actual stroke occur. Can stroke be prevented? Yes. Making lifestyle changes, getting regular exercise, lose weight if the person is overweight or obese, eat a balanced, healthy diet with lots of fruits and vegetables, low-fat dairy products, low in meat, sweets, and refined grains, eat less salt, no smoking, and limit drinking alcohol intake. In addition to take medication exactly as directed, those include blood pressure, cholesterol, and medications to prevent blood clots, in addition to those that lower blood sugar to keep the blood sugar as normal as possible. Living a healthy lifestyle is easy for anyone to say. However, it takes understanding, commitment, and tailoring of the medical health regimen to the unique person's circumstances. Considering their daily lifestyle, type of food that they eat, their culture, belief, and other background to understand what they value most in life and that motivate them to live a better life without disability. Therefore, recognizing diversity and seek to understand and implement cultural competency and cultural humility is extremely important in the realm of promoting health education to patients, community, and the public at large. Thank you for watching my video. These are my references.